Hi, everyone. My name is Niloofar Dehghan, and I want to talk to you about our recent publication in jbjs, which was a multi-center randomized controlled trial comparing surgery to non-operative treatment of flail chest injuries, specifically looking at opioid pain medication utilization and functional outcome scores. So this was a multi-center study that was conducted over a few years across Canada and the US. The initial study was published in JAMA Surgery in 2022, and what that showed was in the subgroup of patients who are ventilated, surgery can improve outcomes by lowering mortality and lowering the length of stay in the hospital and time on a ventilator. But for the non-ventilated patients, we didn't see much of a difference or improvement with surgery. Now, one of the criticisms of that study was that we didn't report on pain and function, and that's where we did in this new study that was published in jbjs. So the primary outcome for this new study was in-hospital opioid medication utilization. And we also followed these patients up for a year and reported on pain and function. So we looked at various outcomes, generalized pain, chest wall specific pain, chest tightness, shortness of breath, and also SF-36 mental and physical component scores. So what were the results? Basically, surgery didn't make any improvement in any of those outcomes I talked about. So whether you look at chest tightness or shortness of breath or pain or opioid medication utilization, SF-36 outcomes, it was all the same between surgery and patients who were treated with surgery or non-operative treatment. So that was obviously a surprising finding for us because there's still a lot of people out there who believe surgery improves pain and function, and that's one of the primary reasons why they do operate. And I think the study potentially makes us take a pause and really see if we truly understand the indications for surgery and if we understand which patients would benefit from surgery. I think we still need to tease that out. But in summary, if you have a patient who's on a ventilator, surgery can improve time on event, length of stay in the hospital, and improve mortality. But it doesn't really seem to make much of a difference with regards to opioid medication utilization or pain and function. And certainly there was no improvement in patients who are not on a ventilator. And I want to thank all my co-authors and all the people who helped participate in this study. There's hundreds of them out there. Thank you very much, and thank you for listening.